and we're not going to go through every day, but I want to go through some specific days. The records that were provided to you were for a particular period of time. Is that right?
Yes.
All right, and I believe the records begin in January and they end on the 22nd of June. Is that correct?
To the best of my recollection.
All right.
Of what year, please?
2009.
Is that right, sir?
Yes.
Thank you.
I want to go to a particular day. I'm going to start on March 12th, 2009, Doctor. All right? And I'm going to show you a record from these medical records, a page from these medical records. And by the way, when I provided you these medical records, you asked me if they were complete. Do you recall that conversation that we had?
Yes.
And I told you that
Counsel's testifying here.
The objection is sustained.
is there any particular way for you to make that determination whether records are entirely complete by looking at what was provided?
Not that I'm aware of.
All right.
Do you have a copy that I can look at here? It'll be more clear.
I do not. I do not. Can you see that? Is it possible for you to
It's
see that?
challenging.
All right. I'll go back and forth with
Okay.
it. All right.
And if you have to
Yes.
approach Dr. Waldman, you do that with the hard copy.
Thank you.
Sure.
Is this something you can see? Can you see it? All right. We see here on this record that's dated on the 16th of March. I'm sorry, the 12th of March. I apologize. On the 12th of March, thank you, Monsieur. A patient name of Omar Arnold. Do you see this?
Yes.
All right, and I've told you that this is the name that Arnold Klein used for Michael Jackson, Omar Arnold. Is that right?
Yes.
Okay. And we see here that this is a page from March 12th. Can you explain, please, to ladies and gentlemen of the jury, what treatment is being described here on this page?
You're going to have to hand me a copy. I'm
I will.
visually challenged here.
Okay, I will.
If I wear my contacts, I can't read. If I wear my glasses, then I won't be able to see in front of me.
It's okay. I'm going to turn on the bank of lights by Dr. Waldman. You can put it on freeze, though.
Yeah. Oh, that's right.
Remember that?
Yes, thanks, Jeff. That's right. All right, let me try that first, and then I'll go over to them. Thank you.
That'll help out all of us.
Yeah, really. Okay, let's see here. Work it out. Thank you.
Thank you.
Technology.
Let me show you the notation on March 12th, Dr. Wall. Can you see that now?
I'm good now.
Okay. Now we're looking at this record here from March 12th. Can you tell us, describe to us what kind of treatment is being provided here on March 12th by this record?
I want to preface by saying I do absolutely no office dermatology, but I'm going to interpret the writing. March 12th, 2008, I believe that's restyling / Botox on the top line next to the date. Underneath that, Demerol 100 milligrams, Midazolam 1 milligram, IM, LUQ, left upper quadrant. There's that looks like that's initialed by someone. At 12 p.m., Demerol 100 milligrams, IM, left upper quadrant. Again, initialed by somebody, and I think those initials are EP. And underneath that, it says restyling 1.0 cc times 1. It has the lot number for the restyling.
We have two medications that are listed. There are two words, Botox and Restylane. Do you see that?
I do.
Do you know what Restylane is?
I believe that it's an injectable filler for wrinkles or something like that. It's not something I've ever used.
All right. But you're familiar with it?
Not really.
All right. What about Botox?
I'm only familiar with Botox the way we're colloquially familiar with Botox, that it's, again, an injectable for wrinkles and things like that.
Do you know, have you, as a result of this case and as a result of this review of these materials, have you made a determination about whether or not Botox or Restylane are painful procedures?
No.
Have you spoken to any of your plastic surgeon friends, your dermatologist friends?
Objection, ask and answer, he's made no determination.
I'll overrule the objection. You may inquire.
Have you done that?
I have.
And have you, as a result of that, made a determination about whether you believe that that there would be a substantial amount of pain for these procedures?
The information that I received was that the standard of care would not involve administration of a strong opioid IM for Botox or Restylane.
Non-responsive motion is stricken.
Sustained. The last answer is stricken.
You are
Disregard, please.
Thank you. You are familiar with what Demerol is, right?
Correct.
And we see that
Overruled.
100 milligrams of Demerol was administered to Michael Jackson at 11:30 a.m. Is that what it says?
Yes.
And then along with 1 milligram of midazolam.
Yes.
Do you know what midazolam is?
Yes, it's a benzodiazepine sedative.
All right. 30 minutes later, the records show another Demerol shot of 100 milligrams.
Yes.
In your view, is there anything significant about how? Let's start with the amount of Demerol that has been administered on this particular day.
Stiff doses. They're above average doses.
All right. When you say above average doses, what would be for an opiate naive individual? What would be an average dose, a reasonable dose?
A starting dose that's recommended for an opiate naive individual would be 50 milligrams.
Explain what an opiate naive individual is.
Someone who had never had any recent contact with opioid medications.
Now let's assume, for the sake of argument, just for the sake of argument, that Demerol shot, and this is an intramuscular shot, is that right?
Yes.
That a Demerol shot was necessary, or Demerol was necessary for Botox, or Restylane for that matter. Would 200 milligrams be a surprising amount to you?
Yes.
How surprising?
It's just a large dose.
If 200 milligrams were given to an opiate naive individual, someone who's not used to getting these medications, what would occur? What would happen?
I believe the patient would be sleepy, lethargic, possibly difficult to arouse, possibly unresponsive. Again, idiosyncratic reactions to opioids occur all the time. There's no good way to predict how someone is going to respond. You start with a small dose, observe, and work your way up if necessary. But I would suggest that 200 milligrams over 30 minutes is a large dose.
All right, let's go to... May I?
Please.
We'll go to March 17th. On these records. Can you tell us what the treatment was on this day?
Similar treatment, but no Botox.
All right, and similar Demerol shots.
Yes.
One at 10:45 and another one at 11:45. Is that right?
Correct.
Are you familiar with the physician's desk reference suggestions for Demerol? Have you looked at those?
No. Other sources.
Do you happen to know what the recommended top limit of a Demerol shot is? What suggestion is?
Yes.
What is it?
600 milligrams in 24 hours.
All right. Now, do you know what the recommendation is for each individual shot? The limits to that?
I don't believe that there is one.
You're not familiar with one?
Your goal is pain relief, and so depending upon the degree of pain, you'll give an adjusted, appropriate dose.
All right. Here we have one at 10:45 and one at 11:45. Is that right?
Correct.
For a total of 200 milligrams of Demerol. Is that right?
Correct.
I want to move forward through these medical records, and you would agree with me that throughout these medical records are these exact types of references: Restylane, Botox, Demerol, Midazolam. Is that right?
That's my recollection.
All right. I want to move to the month of April and look at what these records show for the month of April. I'm going to start with April 2nd and April 6th, and I'd like you to read, please, into the record what we see here. What was provided on the 6th of April at 8 p.m.?
Demerol 200 milligrams and midazolam 1 milligram IM LUQ, left upper quadrant.
And this was one shot, in one shot.
Yes.
All right? Let's turn to, from April 6th, I'd like to turn to April 9th. And we see, once again on April 9th, at 3:30 p.m., you can't see. I forgot. Tell us what treatment was provided on April 9th.
3:30 p.m. Demerol 200 milligrams, midazolam 1 milligram IM RUQ, right upper quadrant.
All right, and then on April 13th?
11:15 a.m. Demerol 200 milligrams and midazolam 1 milligram IM LUQ, left upper quadrant.
All right, and this is Restylane on both days, the 9th and the 12th, is what it suggests?
Correct.
13th or 12th?
13.
13th, thank you. Thank you. Let's go to April 15th. Tell us, please, what was provided on this day to Michael Jackson?
Demerol 200 milligrams and midazolam 1 milligram IM, right upper quadrant.
All right, and then once again, a 200 milligram shot?
200 milligrams with 1 milligram of midazolam, yes.
All right. This is April 17th. And we see in these records, once again, what types of treatment.
Botox in the axilla for perspiration. Axilla is medical term for armpit.